Here is your question. Please start reading.
There is any slides except this?
It's just this one slide. All the rest of the information that you have read in your traditional notes, just use that.
Okay,
Yes.
I'm ready.
16 seconds left, so please just wait. Right, so if you have read and understood, considering it communication skills station, kindly please begin.
Hello.
Hello. Yeah.
Dr. Ahmed Abdu, Senior House Officer, working for Mr. X. I'm calling to speak to the IT Registrar to ask him about advice for a case of unwell unwell lady, which is admitted today, and to ask him also to arrange to book a bed post-operatively for ICU. Could I check that I am speaking to Mr. X?
Yeah, this is Mr. X. Please go ahead.
Okay.
Summarize your case.
Yes. It's Mrs. Marina, 76 years old. The main problem is we are suspected that she has a perforated viscous, and on clinical examination she has a background of COPD, and when we withdraw bloods, this showed the potassium level is low, and the potassium level is low, and the signs of metabolic acidosis, and also the creatine level is high than normal. We make him some imaging. Chest X-ray showed no air under diaphragm, but the ultrasound showed to us a free abdominal collection, and our consultant is asking us to is seeing that we should take her to the operative theater for an urgent laparotomy.
Did you examine her abdomen? How is her abdomen?
Yes, her abdomen is rigid and tender.
Okay.
And
what about the vitals? Is the patient stable?
The patient, I don't have this information right now, but I will check this and I will inform you.
Okay. How much is the hemoglobin? Is it okay? Hemoglobin levels?
This information is also not provided now, but our consultant is arranging here to get an urgent laparotomy, and I ask you for any advice before pre-operative, and also for post-operative ICU bed after she get out of the operation.
Okay. What are the investigations you would like to do for this patient? What other, how will you resuscitate the patient, and what all investigations would you like to do?
Okay, firstly, because of the condition of perforated viscous, I will start by inserting nasogastric tube, and the patient will be nil per mouth. Then I will go for bloods, full blood count, and coagulation profile, renal function test, and liver function test. And I will also repeat the electrolytes and the ABG analysis. Also, I will repeat the X-ray, and I will make ECG. Then I
Okay.
will check if the patient is or if is still on the steroids to increase the dose and shift her to the hydrocortisone. And
Good.
also I will confirm that she in a low oxygen saturation because of on a low oxygen concentration because of the condition of COPD. And I also inform the anesthesiologist about this to examine the patient pre-operative.
Okay. How will you do the fluid resuscitation? What fluids do you want to give?
I will start by fluid challenge, 10 millimeter per kilogram for 15 minutes, and I will check the response. If there is no response, I will shift to colloids.
Okay. Can you tell me the criteria for admitting a patient in the ITU?
The criteria in acute condition, if the patient have acute organ failure, but it's reversible, or one organ chronically impaired, and the possibility of another organ to be involved, and if the patient need respiratory ventilation, or the patient need one-to-one nurse observing.
Okay. Suppose I have only one ITU bed left, and there comes an asthmatic lady to me. So what do you suggest in such case?
Okay, I will keep the patient after post-operatively in the observing and recovery room until the bed is available, and I will also contact to you and to the bed manager I will keep contact until there is a bed available, and I will transfer the patient in this condition.
Okay. Okay, we will be arranging a bed. You can shift her after the surgery. Okay.
You can summarize all the orders that you've been given before you transfer the patient.
Okay. Mrs. Marina, 76 years old, known COPD patient, and on therapy of cortisone, with perforated viscous. Metabolic acidosis and hypokalemia. Here ultrasound showed free intra-abdominal collection. So it will go for urgent laparotomy, and we are arranging a post-operative ICU bed after post-operatively.
Yes, the advice, all the investigations and the management that you discussed with the ITU registrar, that is what
Yes.
you have to summarize at the end.
Okay.
Yes. You
Okay.
still have 30 seconds if you can quickly do it, please.
Okay, I will go for full. I will start by for the patient by nil per mouse, and I will insert a nasogastric tube, and then I will complete my routine investigation, and I will repeat chest X-ray and ABG. Then I will go for ECG, and I will confirm that the patient on steroid or not to shift her to hydrocortisone and increase the dose. Also, I will check the oxygen saturation and oxygen concentration because she is in COPD.
Okay, thank you. Can you please just tell me how would you give oxygen to the patient?
In case of COPD, we'll keep the concentration low from 24 to 28%.
Yes. What type of mask?
Venturi mask.
Okay, good. Right. And what made you think that patient has perforated viscous?
Because on clinical examination, we found signs of peritonitis like rigid and tender abdomen,
Yes,
and
and
the ultrasound
ultrasound. Yes,
and the ultrasound confirmed our diagnosis by finding a free intra-abdominal collection.
yes, and but chest X-ray was clear.
What?
Chest X-ray was clear. It was
Yes, repeat it. We will repeat X-ray
Okay,
because
good.
first, yes.
good. Thank you.